Okay, you guys, Ralph Havens here, physical therapist, and I'm with Dr. Tom Giammatteo, chiropractor, naturopath, and co-developer of Integrative Manual Therapy. And today I want to talk about runners, because I've been seeing a lot more runners here in Bellingham, and I'm realizing we're not just about improving, getting people over injuries, but also about performance, improving, optimizing their races. And there's two things that I tend to do before, as a first session or two, usually in the first session, that I want to talk to Dr. Tom about, because it's really a key to changing things fast for runners and improving performance, improving stride, and it's something that I haven't seen in the chiropractic and osteopathic world yet. So, Dr. Tom, thanks for getting on with me here, and I'm interested to hear what you say. I've got some stories of my own about using these techniques and for helping people get over injuries, but also improving performance. So welcome. Yeah,
Hi, Ralph. How are you?
I'm good.
Good. Hi, everybody. Yeah, we just finished winter school at the beginning of March, and we had the whole class, which was a 900-page look into the body's function of ambulation. So fast ambulation is running, right? And regular walking versus running is that your feet, one foot never leaves the ground when you walk. But when you run, you're actually leaping in the air or you're falling forward, right? So it's an advanced skill of walking. And you were also trained in the ambulation class to really look at those processes there. So as we run, we were running through the forest barefoot at the beginning, and then we got shoes and sneakers, which in some cases can be, in some interpretations of running, barefoot running may be even better than wearing the shoes, because the plastics of the shoes really don't give us the feedback we need in the shoe cases. But every time we leave the air, we're leaping and we're landing again, and we're putting at least 50 to 200 pounds of force every time we strike the ground. And if there's a little pebble or a stick in the way, our foot and shoe has to come and conform that. And sometimes that could put a glitch in the whole system, right? So biomechanics, which is how joints move and how they articulate, every joint articulates and makes that pattern of running happen, is very important. And if we're running a long time and you're running during the winter, you're running during the rain, you have a little slip and fall, and maybe the next day you feel like you pulled your back and stuff like that. So IMT has been around for 40 years, and you have protocols that we have used on your son, and we have used in lots of different athletic processes, especially the ones of running, like football, baseball, track and field, lacrosse, soccer, where you have a dynamic and you have to be able to move. And sometimes that you have other parts of your environment making you shift. So our muscles aren't smoothly gliding. And that first pattern we talked about is called strain counter strain for the synergistic extremities, right? And we have for the lower extremity, it's about 10 different positional releases in both legs that helps with flexibility, helps reduce muscle strains, muscle pulls. And we actually used it in the University of Tennessee's women's basketball team in 2007 to 2009, and they were national champs during that time. And the only injuries that the women basketball players had were sprained ankles and broken noses. They didn't have any leg pulls, gastroc pulls, or anything like that. And the injuries they did have were things that they couldn't control outside of the body. So the advanced strain the strain counter strain for the synergy pattern should be done at least once a month on any runner, and I think once a year on just the general population to reset all those mechanisms. The second set is the advanced strain counter strain for the diaphragms. And that really gets into the stability and the understanding that we're more than just one section, where we need our diaphragms and our core stability to be there at the same time. So those processes have to happen too. And that's a series of five techniques done both sides. So it takes about 25 minutes to do. And last year we published a little study with a professor of ballet at Yale, and she had between 13-year-olds to 18-year-olds in her class, and they just did the pelvic floor and the respiratory diaphragm. And over those 6 weeks that the class was together, they gained 4 to 6 inches on their hamstring flexibility just by doing this little 10-minute pre-warm up before they started their performances.
That's cool. Just doing 2 of the diaphragms. Isn't that
Yep,
interesting?
yep. And ideally, the ones that did even the whole series even got better faster. So,
Yeah, I do. I work on my son, Ben. He's a sub 5 minute miler. He's a little
wow.
13-year-old. He's doing great. He's racing tonight. And 3 or 4 times a week I work on him because I can. I say, Noah Lyles has his physical therapist work on him, throughout the week. So, and he always asks me, Papa, can you work on me? And of course I do. And yeah, we use that strain counter strain to just he has a beautiful stride, and it's incredible how the strain counter strain just balances and gets that optimized.
Good. And then IMT really looks at the forces of three-dimensional spaces. You know that TV series called The Big Bang. It's about comedy, and they talk about really high
Love that show.
scientific things, right? So, people are getting more aware there are multiple dimensions. There's string theory, there's multiple realities. We're in a third dimensional world when we're in a fourth dimensional world. But my journey into body work, I was only taught one technique in that whole time that brought up a three-dimensional space. And my system actually goes into it with a lot less energy and fatigue to the person at the same time. And the first technique was called Muscle Energy by Dr. Lawrence Jones. No, Dr. Mitchell.
Yeah, Mitchell. Yeah.
Dr. Lawrence Jones was a strain counter strain inventor. He was a osteopath also. But in all my world of going from physical therapy to chiropractic school to acupuncture, when people were making an assessment of a joint and they would say you had arthritis in it, they would just do these things called mobilizations or manipulations, which would just push on the two surfaces and make them pop, right? And until muscle energy came, we didn't have spaces in the joint. So the example I give for that is if you have a folding chair, when you pop it open, you can stand on the chair and you get taller, and the folding chair takes up a big space. So that's an open three-dimensional space. But when you close the folding chair, it doesn't even stand up by itself. It just falls over, and that's a collapse space. When we have an abnormal joint, it's like the folding chair that's collapsed, and the cartilage start to rub on each other, and eventually the cartilage wears away, and then you got arthritic changes in the whole thing. So starting with muscle energy, and now what we call it helix biomechanics, we actually make the space rise up, and the joint fluid can get in there and can glide back and forth. So the human body is just really amazing, Ralph, because
It is.
the synovial fluid, which means joint fluid, is is a solid when it's put under pressure, and when you release it, it becomes a liquid. So every time you put pressure on it, it turns to a solid platform, and it's 1,000 times slipperier than ice. So the cartilage never really touches itself. It's gliding on this surface of synovial fluid. When you have an abnormal joint, the fluid doesn't get to stay in there, it gets squirted out to the sides, and you start to rub down, and that is what arthritis is.
Yeah, because it's like you couldn't really hit the ground that many times throughout your life and expect little cartilages to just last like shock absorbers. There's this energetic thing that happens. That's such an interesting phenomenon. And then with the different ways you do it, we have the muscle energy technique from the osteopaths, but then you guys develop mobility templates and then helix biomechanics, and it does something to help with this space. Tell us about that.
That's why I was just talking about that chair that folds and
Yeah.
the chair that opens up. So no, when I started discovering three-dimensional space, and we were getting tissue repair. There was a Dr. Slaughter, who was an orthopedist in the 1900s, who used to saw people's legs to change the surface tension on the hip bone, and he'd get these fabulous changes. And now we have total hips and total knees, and they forgot about the old styles of things that were really working better, but you could get a whole lot more money for a total hip in the area too. But we want to create that space so the synovial fluid gets there and creates a temporary surface to glide on. And then when you release the joint, it changes, and it's already repairable. It's never like an old hinge on a door.
I guess it's the kind of thing you have to actually experience, because it's like, how does that happen? You just have to feel it. And people tell us they have more space in the body, they're looser, they love it before races and stuff. Yeah, and then there's something that, another thing in IMT that we find so common, and it's one of the early things we do in treatment, especially for athletes, is descendant phenomena. And the idea of if somebody's been in car wrecks or had concussions or been knocked out, there's something that happens to the spine that causes a lot of problems if you don't fix it up over time. What's the descendant phenomena thing?
We call it a descended sacrum, right? And we believe that, and it's been written in anatomy, that the sacrum all the way up through the spine to the head are one unit. And inside there, you have a dural membrane, which can hold your spinal cord and your cerebrospinal fluid. And what we found that in head injuries or concussions to the head, the fluid in the brain gets squished down and into the sacrum, and the sacrum doesn't have its full range of motion. It gets locked between the two pelvis bones. And it sort of gives this yanking, pulling on the body, and it throws the nervous system to hyper facilitated or hyper vigilant in that area. And I, again, don't know of another phenomenon or another practice of medicine or acupuncture or other Eastern philosophies that say until the sacrum is in balance, the body can't heal itself. So we feel that it's pulled down to the floor, and that stresses out the body.
And that's like people that have had car wrecks or big falls or head injuries or concussions. Can it happen? I had somebody yesterday that said, "Oh yeah, no car wrecks throughout my whole life," but then I started to evaluate her and work on her, and she's like, "Oh, but when I was playing soccer, I got knocked out a couple times."
Right. So all concussions, any of these people that are chronically sick, we find descended sacrums having a disability a lot in autism and Asperger's disease. Anybody that is sound intolerant, touch intolerant, sensitive to even allergies can be a descended sacrum phenomenon at the same time.
Yeah, that it pulls on that brainstem that has that vagus nerve, I guess, that innervates the whole GI tract and everything. Well, this is really cool. I wanted to do this session because it might be a bit scientific-y and technical, but it's two phenomena. This joint space phenomena, and that can be restored with helix biomechanics and also strain counter strain, and then clearing this descendant phenomena. I find I use that with the runners in the first session, usually if I can get enough time with them, and for sure in the first two sessions. It's such a valuable piece, and like I said, it improves the runners before they do their races. Yeah, thank you, Tom. Anything else you want to say? I want to give your site, imtwellnesscenter.com. Tom's in West Hartford, Connecticut, and his phone number, he'll actually talk to you and let you know what he sees that's going on, and if he can help you, let you know what to do. 860-561-2286. He's on Main Street in West Hartford, Connecticut. So and I'll leave my contact information below too, ralphhavens.com. I'm on the West Coast, Bellingham, Washington. So yeah, Tom, thanks a lot. Our little boy is running a race tonight. is part of his team. So he had a nice race last weekend. Like I said, he broke 5 minutes for the mile, which was exciting.
Awesome.
Yeah,
Congratulations on that, Dad.
a little seventh grader. So yeah, we got a running town here. So thanks so much. And
Yeah, and I'm gonna say Ralph has these really simple protocols, 1 to 2 visits. He can teach you how to do this and put it in part of your stretching program, and it's an anti-injury program for shin splints all the way up to low back pain and foot problems, just by learning these 5 simple techniques that you can do with some help with somebody.
yeah, so I'll put links below. And yeah, and Tom's helped me a lot over the years. I met Tom in February of 2000. And I remember getting the flyer for the class, and I'm like, they're gonna teach me this stuff in 3 days? Are you kidding me? And I took it and fumbled through it, but I had the best week of running after that week. And so I talked to Sharon and Tom and said, hey, come to my office and start teaching this stuff. And I've been following those guys around for all those years, and was taking a class a month for many years. So helped me a lot, helped my family, and we reach out to Tom when we need help. So yeah, Tom, thanks so much, man. And
It's always been fun, Ralph. Thank you.
all right, and I'll say hi to everybody that's over there right now,
Okay.
Hartford, and I'm gonna connect up with the people I talked to before, and I'll see you guys later. Thank you,
Bye,
Tom.
Ralph.
Bye.